Dr. Owais Durrani. Doctor, welcome.
Thanks for having me.
Of course. So the CDC says 2,300 people have died from heat-related illnesses in 2023. Doc, that's more than all other weather-related deaths combined that year. What are your biggest concerns for this weekend?
Absolutely. It's kind of shocking, right? When we're getting a hurricane, there's all these alerts and everything. So I'm glad we're talking about this. This is kind of our big first hot weekend of the summer, the second day of summer. And so it is good to refresh on these things. I think it's very important to kind of know the signs and symptoms of heat exhaustion, heat stroke, when your body may be telling you to get out of the heat. Things like feeling faint, lightheaded, your heart pounding, any signs of confusion, nausea, muscle cramping. Those are signs as soon as you realize those, whether it's within yourself or a family member or a friend, let's take a break, let's get in the shade and cool down, because you really don't want to be on that spectrum, because things can escalate very, very quick to a medical emergency.
Last year, nearly 120,000 health-related emergency room visits were recorded, and this was across the country. I have to ask, Doc, what are the signs and symptoms of a heat emergency? When do you go to the emergency room?
Yeah, absolutely. So I like to think of it as mild, moderate, and severe, right? So mild is going to be heat cramps. So, you've been out, maybe running a bit, you start to get cramping feeling, that you're okay. You can, drink some water, cool down. Usually symptoms resolve within 30 minutes to an hour. When it becomes an emergency is when you stop sweating, when you have really, really hot skin, when you start to have vomiting. And the number one thing is when those around you notice that you're confused, you're lethargic, those things mean that you are going into that heat stroke area. That can lead to organ failure and unfortunately death. So anytime you get on that spectrum of severe symptoms, call 911, get to an ER, and we're there to help.
Dr. Durrani, talk to us about the differences between heat exhaustion and heat stroke.
Absolutely. So they're on a spectrum. Heat exhaustion, usually you're going to still be able to regulate your temperature. And so the systems in the brain are going to cause you to sweat profusely. You might have heart pounding sensation. You might be nauseous, cramping, lightheaded. You should get into the shade, drink water, drink electrolyte-rich beverages. You can use a cool towel to kind of cool yourself down, cold shower. When you become a heat stroke, kind of on that end of the spectrum, your body's ability to regulate its own temperature, you lose that. And so that's when you get the confusion, seizures, things like that. And unfortunately, it's nothing you can do at home. You have to go to an ER and you need intensive level of care and monitoring.
And we know infants and the elderly are typically the most vulnerable when it comes to heat. The EPA says those over 65 account for more hospitalizations than any other age group. Talk about that and what we can do to help our elderly, cool them down.
Absolutely. And so as we age, our mechanism to want to drink water, that thirst sensation kind of goes down. And so we're not drinking as much water as we need to. In addition to that, usually you're going to have some medical conditions. You may have heart disease or kidney issues. That makes you more susceptible as well. And then you may be taking certain medications for those conditions, which make you dehydrated or makes it more difficult to regulate your temperature. And so if you have elderly neighbors, friends, make sure you're checking on them. Make sure they're keeping themselves cool. Make sure there's a plan in place and that we make sure that the most vulnerable are taken care of.
What about some practices for prepping a baby for the summer when they rely on their parents for just about everything?
Yeah, absolutely. They can't talk to us, right? So babies, they don't have a mature thermoregulation system, so their sweat glands aren't fully developed. Like I mentioned, they can't tell us they're thirsty. And so when they are outside in the sun, particularly infants, can get overheated very quickly. And so never put like towels or any type of coverings on strollers that can kind of trap heat. Make sure there's no direct sun exposure for extended periods of time. Make sure that they're wearing loose fitted clothing, and then ensuring that you are feeding them frequently as well. If you notice that they're really irritable, if their skin is kind of red and flushed, those are some initial signs to get into the inside and get them cooled down.
Thank you so much for that. Dr. Durrani, I'm running out of time, but I want to ask you what do we need to know about excessive heat dangers for those on prescription drugs like, let's say, antidepressants?
Absolutely. So certain medications like antidepressants, they work in the brain. Our temperature regulation system is in the brain. So you're going to be a little more susceptible to getting dehydrated. You're going to sweat less. So just kind of keep that in mind. Drink plenty of fluids. And most of all, do it in a safe way and enjoy the summer.
Well, thank you so much, Dr. Owais Durrani. We appreciate